So my name's Chris Zimmerman. I've been a neurosurgeon here in Boise for about 30 years. I've worked at St. Al's for the entirety of my career. This was in early January of 2020, before PCR testing and before, before the CDC actually recognized, first cases of COVID in the United States. And we all had the catarrhal symptomatology, low-grade fevers, joint pain, congestion. But, luckily, I, like everyone else in my family, this actually passed within a 48-hour period. But I did seek consultation from the infectious disease because I think the uncertainty was enough that we were all concerned. And, by default or by, lack of appropriate testing, the diagnosis of COVID being different from flu-like symptoms or influenza-type symptoms, he felt that was indeed the case. So yes, I did have a very mild case, and it did not impair me. Within 2 weeks, pretty much all those symptoms had relieved themselves. We didn't have a vaccine, a year ago. We didn't have a vaccine a year and a half ago, and we know vaccines work. For me, I work in a high risk. We work in a high risk. All of us do. You walk through the halls of a hospital. You walk through the wards. You walk through the emergency room. That's high risk. And so, if I was a bricklayer and I was outside all day, maybe things would be different. But I'm not. So I work here, and I support my fellow coworkers. Emphatically, I've done it, for 30 years. This hospital worked diligently to get their personnel vaccinated, and for all the reasons being that to protect one another, protect the community, and to stave off the most critical part of this disease, which is, death, and or prolonged hospitalization, or, the chronicity of the disease itself.